بسم الله الرحمن الرحيم وبه نستعين. Inshallah, I'm going to demonstrate one of the Mulligan technique for tennis elbow. It is we are going to talk a bit about tennis elbow and Mulligan concept, okay, and how to treat this with Mulligan techniques. Okay, as we all know that there is number of modalities can be used as far as physio is concerned, and overall management in terms of medical management or surgical management, this is not our concern. Our concern is how to demonstrate treating tennis elbow using Mulligan concept. Okay, we are going to use different approaches. Mulligan using demonstrating belt. We can demonstrate it how to do it manually, and we are going to do taping to maintain what you have been achieved using either the manual approach, Mulligan, or the belt. It is being encountered among tennis players, but this is again is one of the overuse injuries or repetitive injuries. It could be encountered among the carpenters, squash players, what you call it, employees who are working in the desk for a long, and the computers operators. These can cause lateral epicondylalgia. Okay, so the patient is presented with anterolateral pain at the elbow joint, and we have, for a clinical reasoning, to confirm the diagnosis, so as we can straightforward do this technique, because there is a lot of differential we have to work on, like pain originating from the shoulder joint or pain originating from the cervical spine. Generally speaking, we all know that there is a different nature of the pain, either myogenic pain, arthrogenic, or neurogenic. So we have to differentiate all these. Tennis elbow presents itself with the pain and anterolateral aspect. Sometimes it may radiate to the wrist and fifth and fourth fingers. Microscopically, the most encountered affected muscles among the extensor groups is found to be the extensor carpi radialis previous. There is a possibility also microscopically encountered extensor carpi radialis longus and extensor digitorum and extensor carpi annalis. But the most common affected muscle in tennis elbow is extensor carpi radialis previous. Okay, this is as far as tennis. So to confirm this, you leave the special test like Cousin test or chair test and all. You have to engage the muscle, that is putting the muscle into action. Like you have to do extension of the wrist with radial deviation, and you have to resist extension and radial deviation of the wrist, so the patient will encounter pain and the lateral aspect of the elbow. And again, the history and the nature of the job of the patient will give you a clue to the diagnosis. Okay, and again, sometimes Mulligan techniques could be used for diagnosis and for treatment purpose. Say suppose you there's certain hypothesis, you assume this is tennis elbow. You have to treat it. If the pain is relieved, it will confirm your diagnosis. So it could be used for diagnosis and therapy. This is the Mulligan concept. Mulligan techniques consist of certain terms like bills and crooks. Stand for pain. I stand for instant. Double L stand for long lasting. So when you use Mulligan technique, you should give a pain relief lasting for a long time. If you are not achieving this, either you are using a rock technique or you are having wrong diagnosis. So this will tell you as a conclusion. For contraindications, so you have to exclude the contraindications possible for each and every techniques, are for repetition, the set of repetition, how many times you are going to repeat the techniques, and O for overpressure. And again, another C for communication skills. So you have to communicate with your patient to tell them what is expected out of them and what is the expected result out of these techniques. And meanwhile, while you are doing this, you have to communicate if you feel a relief or discomfort. So sometimes you may need to alter or modify your grip or your direction of pull. Again, K stands for knowledge. The knowledge of the physiotherapist about the pathologies they are dealing with. S stands for so many things. Sustain, you have to sustain what you have achieved out of these techniques. And again, S stands for skills, the skills that makes you capable of doing the techniques in a better sense. And S again stands for sense, the sense of your hands that tell you where you are and what you are doing. Okay, this about crooks. So for generally speaking, you have to rule out contraindications, then only you have to explain the technique to the patient, and then you go ahead. Okay, now we are going to confirm our diagnosis about how to engage the muscle to confirm that is the patient having got tennis elbow. And after that, we say that is proper diagnosis. Now, after that, we are going to demonstrate Mulligan technique for tennis elbow using belt. So now I'm going to demonstrate lateral Mulligan glide for tennis elbow using belt. So you have to place like if you are treating the right tennis elbow, you have to put the belt onto your left side, and vice versa. If you are treating the left side, you have to put the belt onto your right side. To grasp an object, to squeeze it onto his palm. So because tennis elbow is very well painful, manifested with the grip. So while you are performing this and the patient is squeezing an object into his palm, you will get a feedback about the pain relief. If now we are doing it in extension of the elbow and supination of the forearm, if you achieve the pain relief and do 10 repetitions, if there's a pain relief, well and fine. If not, we have to modify your position of the elbow, some degree of elbow flexion to relax the painful area. So what we do is to confirm the pain on the anterolateral aspect of the elbow, we have to resist the extension with radial deviation. Can you do that? And do radial deviation. Take it out. Okay, resist it. Is it painful? Some pain. So this is positive for the lateral epicondylitis. To put an object to squeeze, when we ask the patient to squeeze, and the patient should squeeze this for 10 times. If you feel any discomfort, please tell me, okay? Now this is, I'm doing the lateral glide for the, you squeeze it 10 times, relax. How the pain is? It's okay. Do you feel pain or the pain is relieved? There is no pain. This is good. This is 4, tiny, again. This is 5, again, because the pain is more while gripping, okay? That is all about the lateral glide using belt. Again, we can do lateral glide like this and ask the patient, you grasp and release. Okay, release. Again, relax. Then again, how is it? Do you feel pain? No pain. This is good. You can do it 10 to 20 times. Okay, 3 times per set. Okay, this for with manual technique using hands. This is the same as belt, but we are using our hands. Okay, this is the second technique for the tennis elbow. The self technique, it could be done by the patient. We need to teach the patient how to do it. So we have to place a towel at the main hole so as to minimize the friction. Okay, and we can put an object here for the squeeze, and the patient mean to incline to the wall and to do lateral glide like this and to squeeze. Okay, if he felt any pain, either he can alter the direction of the glide and keep squeezing. This is for self exercises. Or if still there is pain, what he can do is he can do some flexion of the elbow while doing the squeeze. Okay, this is a self demonstration to the patient, and now the patient is coming and doing it. Okay, now we take the measurement. So the opposite side of the main tape, this is the rigid Mulligan tape, and take the measurement. It should be not fully encircling the forearm, just you leave a gap between two edges. Okay, now 2 layers is applied. This is the first layer. Okay, again this is the second layer. Approximately is this. Okay, so with the help of an assistant, we are going to apply the 2 layers of rigid Mulligan tape. Now I'm squeezing the lateral main muscles, that is the common extensor groups. I'm squeezing them. Okay, all right, get the second layer, put it over this. Okay, 1 minute, then all right, then take it. Now we are summarizing this elbow, which is a very common encounter conditions. We have demonstrating doing lateral glide with the help of the belt, and we have demonstrated how to do it manually. Of course, there is a difference when you are doing it manually and when you are doing it with belt. With belt, it is easier, but manual approach, it is cheaper in a time wherein you don't have belt. So you can use it, use your hands to demonstrate and treat your patient with little to no cost. And then we have demonstrated the rigid Mulligan tape. After you successfully relieve the patient pain with using the concept, you have to maintain your achievement. The degree of pain relief you have achieved, you have to maintain it throughout. You can apply the rigid Mulligan tape. Okay, and this is we have shown just now, and we have shown also a self exercise for tennis elbow using the same Mulligan concept to the patient to be done at home. So the patient could repeat this 10 times over 3 repetitions. Mean like if it was successful with the physiotherapist, the main patient himself could practice this at home. And you, for the first time, you apply 3 repetitions. 3 sets for 10 repetitions, and you ask the patient to be seen after 48 to 72 hours to reassess again and see your achievement and the degree of patient pain relief. This is an idea to share my knowledge with my Sudanese fellows, physiotherapists, and the younger physios, and again to motivate them and myself as well for further depths of manual therapy This is the trend now. The management of musculoskeletal disorders, it more or less, it is entirely based on manual therapy. So, and Mulligan is one of the sound and leading concept to relieve the musculoskeletal conditions. So I wish you all the best, and this is little contribution to the well-being of the Sudanese physiotherapy networks.